Right. Let's get straight to the point, because I know exactly why you've clicked on this video. You're a man over 60, and something's changed. Something that used to work perfectly well just doesn't anymore. And you're wondering if there's anything you can do about it without popping pills or having awkward conversations with your GP. I'm Dr. Amelia Wright, and I've been practicing medicine for over 25 years now. I've spent a good chunk of that time working with men's health, particularly with chaps in their 60s, 70s, and beyond. And I'll tell you something that might surprise you. The problem you're experiencing isn't really about age. It's about blood flow. And that's actually brilliant news, because blood flow is something we can work with. Now, before we go any further, I want to make you a promise. By the end of this video, you'll know exactly 3 specific areas on your body you can stimulate to improve circulation down there. I'm going to tell you precisely where they are, how to find them, and what to do. No waffle, no endless theory, just practical information you can use tonight. But first, let me explain why this matters so much, because understanding the why will help you stick with this. Sexual health is like the tip of an iceberg. When something goes wrong in that department, it's often a sign that there's something bigger happening beneath the surface. After 60, this signal becomes even more important. We're not just talking about desire here. This is a powerful biological indicator, and frankly, it's one that's ignored far too often. Here's a statistic that might shock you. According to the International Association of Sexual Medicine, more than 70% of men over 60 experience some degree of erectile difficulty. 70%. That's not a small number, is it? But here's what's really interesting. In most cases, the underlying cause isn't psychological, and it isn't hormonal. It's vascular. The blood simply isn't getting where it needs to go. Think of it like this. Your sexual function is a bit like a light bulb. If the electricity isn't flowing properly, the bulb won't light up. In a man's body, that electricity is blood. Circulation is the conductor that carries life to every part of your body. When it gets disrupted, everything starts to slow down. Recent research published in Urology Times points out that blood flow to the penis can actually serve as an indicator of your overall cardiovascular health. In other words, if the blood isn't flowing well down there, it might be a warning sign that the arteries throughout your entire body are under stress. So addressing this isn't just about your love life. It's about your heart, your brain, your whole system. Now, here's the good news. There are natural, simple, and effective strategies that can help change this situation without medications or artificial interventions. And that's exactly what I'm going to share with you today. Let me explain what's actually happening in your body. A man's erection is fundamentally a vascular process. It all starts when your brain sends a signal through the nerves in your pelvic area. This activates nitric oxide, a substance that dilates the blood vessels and allows blood to flow powerfully into the organ. But as we get older, this reaction weakens. This happens for 3 main reasons. First, there's endothelial damage. The endothelium is the inner lining of your blood vessels. It regulates flow, elasticity, and dilation. Over time, chronic inflammation and poor dietary habits make this lining stiffer. The vessels narrow, and blood has a harder time getting through. Second, there's reduced nitric oxide production. This compound is essential for erections, but after 50, your body produces less of it. Research published in the Journal of Andrology showed that men with erectile difficulties can have nitric oxide levels up to 50% lower than normal. Third, there's plaque buildup in the arteries. Small deposits of fat, calcium, and cholesterol often accumulate in the thinnest vessels first. And guess what? The vessels in the penis are some of the thinnest in your body. They get affected before the larger ones do. This means that sexual dysfunction can actually be the first visible sign of developing cardiovascular problems. So what seems like a bedroom problem might actually be your body sending you a warning about something more serious. These processes don't happen overnight. They're the result of years of small habits, poor nutrition, sedentary lifestyle, chronic stress. They accumulate quietly until your body starts shouting. But here's the thing, this can be reversed. With the right stimulation and proper nutrition, your body can produce more nitric oxide, open up the channels where blood needs to flow, and activate nerve endings that have been dormant. And the simplest way to start is with a daily ritual that takes just a few minutes. I'm going to show you exactly what to do right now. There's a physical stimulation technique that doctors and manual therapists in Europe and Japan have used for years to improve circulation, awaken tissues, and enhance nervous system response. It's called tapotement. Tapotement is a form of rhythmic percussion performed with the hands on strategic areas of the body. This technique activates deep receptors in the skin and muscles, triggering a cascade of physiological effects. It causes the release of nitric oxide in the vessels of the pelvic and thigh areas. It improves local muscle tone, promoting contraction and expansion of tissues. It increases temperature and blood flow exactly where it's needed most. In other words, the body wakes up, the nerves respond, and blood starts circulating more easily. A study conducted at the University of Essen in Germany showed that manual percussion techniques applied for just 2 minutes were sufficient to increase blood flow by up to 30% in the stimulated area. And the best part, you don't need any devices or anyone's help. You can do this yourself, at home, with complete privacy and safety. All you need to do is follow 3 steps, each targeting a key zone of the male body. Let me walk you through them one by one, and I'll be very specific about the locations. Zone 1 is the lower abdomen. This is the area located directly below your navel, about 2 to 3 finger widths down. In medical terms, it's called the hypogastric zone. You can find it easily. Just place your hand flat on your belly with your little finger touching your navel. The area under your palm is where you want to focus. Why start here? Because major blood vessels and nerves pass through this area before reaching the genitals. When you apply rhythmic firm taps to this zone, you're essentially activating the system that controls blood supply to the entire lower body. The muscles warm up, the vessels dilate, and the nerves receive direct stimulation. Think of this point as the command center. When properly stimulated, it prepares your entire vascular system to work better. Here's how to do it. Use your fingertips or the edge of your palm. Perform short, firm movements, like gentle drumming, for about 40 seconds. Keep your breathing normal and your body relaxed. You're not trying to hurt yourself. Just wake things up. Zone 2 is the inner thighs. Not many people know this, but the femoral artery, one of the most important arteries in your body, runs right through this area. It's the main highway delivering blood to the male reproductive organs. To find this zone, sit down and place your hand on your inner thigh, about halfway between your knee and your groin. You might even feel a slight pulse there. That's the femoral artery. When you perform tapotement on the thighs, especially on the inner side, you activate this artery, improve blood flow, and warm up the pathway through which blood travels to the base of the penis. Additionally, this zone contains nerve endings connected to arousal and sensitivity. Here's how to do it. Sitting or standing, perform light taps with your fingertips, alternating hands for 1 minute on each leg. The goal is to create a gentle warmth in the area. No pain, no redness, just activation. Let me tell you about one of my patients. I'll call him Robert. He's 67, lives in Manchester, worked as an electrician for 40 years before retiring. After several months of struggling with sleepless nights, loss of firmness, and a constant feeling of disappointment, he came to see me at his wit's end. I taught him this simple ritual, and he started doing it every morning. At first, he thought it was a bit daft, to be honest. He told me, "Dr. Wright, are you having me on? This actually works." But he decided to stick with it for at least a week. On the third day, he woke up feeling different. There was a lightness in his body, his mood was stable, and something happened that he hadn't experienced in months. A spontaneous morning erection. It felt like something inside had started working again, he told me during his follow-up appointment. By the end of the first week, he'd also noticed an improvement in his confidence. He started looking his wife in the eyes again with assurance, and they both felt intimate, warm, genuine closeness for the first time in months. And all this without a single tablet, just proper stimulation in the right places, every day. Zone 3 is the base of the organ itself. This is the most strategic point. This is where blood arrives, where tissues expand, and where the erection actually happens. You'll find this zone right where the shaft meets the body, at the very base. When you apply the right touch to this zone, you awaken what we call the cavernous nerves. These are responsible for transmitting arousal signals to the brain and regulating the strength of erections. Now, tapotement in this zone must be respectful, consistent, and confident. No rushing, no aggression. This isn't about force, it's about rhythm. Here's how to do it. Use your palm or fingers for light, repetitive movements for 30 to 40 seconds, always focusing on rhythm and regularity. You should feel a slight pulsing sensation. That's the sign that your body is responding. When these 3 zones are stimulated in the correct sequence, something remarkable happens. It's like rebooting a system. Blood begins to circulate more easily, tissues wake up, and the whole mechanism starts functioning again. But how can you amplify this effect even further? The answer lies in a natural, often overlooked food that increases nitric oxide production and helps keep vessels dilated much longer. Every good motor needs quality fuel, and the same applies here. This is where strategic nutrition comes in. It might seem like an ordinary vegetable, but beetroot is a powerhouse for vascular health. Rich in natural nitrates, it has a direct impact on nitric oxide production, the gas that dilates blood vessels and improves circulation. Why is this so important? Because nitric oxide allows blood to flow with greater pressure and volume. It facilitates erections by increasing the filling of the cavernous bodies. It helps tissues maintain firmness for longer. Research published in the Journal of Applied Physiology showed that after consuming beetroot juice, there was a significant increase in peripheral blood flow, especially in the body's extremities, including the genital area. Another study conducted by Queen Mary University of London demonstrated that men with mild to moderate erectile difficulties experienced noticeable improvement in function after several weeks of daily beetroot juice consumption. Here's a simple practical recipe you can use every day. You'll need 1 medium-sized raw beetroot cut into chunks, 1 lemon squeezed, 100 milliliters of water. Blend it all together and drink it on an empty stomach, about 30 minutes before performing the tapotement ritual. The combined action of the drink and physical stimulation triggers what I call a genuine unblocking of the blood supply system. You can drink this juice every day for a week and watch for the signs. You'll wake up more alert. Morning erections will return. You'll notice more firmness during intercourse. This simple juice works like a deep clean for your arteries. It dissolves the excess resistance that's blocking free blood flow, preparing the ground for the tapotement to work even better. With this complete ritual, nutrition plus physical stimulation, you're acting directly on the root cause of vascular impotence without resorting to medications. Now, I know some of you might be thinking, this sounds too simple to work. And I understand that skepticism. We've been conditioned to believe that real solutions must be complicated, expensive, or come in a prescription bottle. But the truth is, your body is remarkably good at healing itself when you give it the right conditions. I've been doing this for over 25 years, and I've seen men in their 70s and even 80s regain function they thought was gone forever. Not through miracle cures or expensive treatments, but through consistent daily practices that support what the body naturally wants to do. Let me be clear about something. I'm not saying this will work for everyone. Every body is different, and there can be underlying conditions that require medical attention. If you're experiencing persistent problems, please do see your doctor. But for many men, especially those whose issues are primarily circulatory, these techniques can make a genuine difference. At this point, you've learned something that nobody told you all this time. Loss of sexual potency after 60 isn't an inevitable fate. In most cases, it's simply a circulation problem. And circulation problems can be addressed with simple, natural, accessible habits. Today you've learned two effective paths. The deportment ritual that activates the key points of masculine vitality, and the beetroot and lemon drink that enhances vessel dilation and improves blood supply. These practices work, and they work quickly, because they're based on physiology, not empty promises. Let me quickly recap the 3 zones for you one more time, because I want you to remember them. Zone 1, lower abdomen, 2 to 3 finger widths below the navel. Zone 2, inner thighs, halfway between knee and groin. Zone 3, the base of the organ where shaft meets body. 40 seconds each for zones 1 and 3, 1 minute per leg for zone 2. That's less than 4 minutes total. Now, everything depends on you. Apply this today. Start right now. Do the ritual, prepare the drink, and repeat it for 3 days. Watch for the signs. Your body will show you that it's ready. If this video has helped you in any way, I'd love to hear about it. Drop a comment below and let me know how you get on. And if you know someone else who might benefit from this information, perhaps a mate, a brother, someone you care about, please do share it with them. Many men suffer in silence, thinking it's too late, that it's all over. But now you know there's a way forward. There's a solution. Of course, everybody is unique, but science is pointing the way more clearly than ever. When you understand the physiology, you can act precisely rather than blindly. And men who understand this change the rules of the game. If you'd like more straightforward, useful, scientifically based content like this, do give this video a thumbs up and subscribe to the channel. Here on Dr. Amelia Wright's channel, we speak the truth and offer real pathways for those who want to live with health, strength, and dignity. I'll see you in the next video with more science, more real solutions, and more life for those who refuse to accept aging without pleasure. Thank you ever so much for watching. Take care of yourselves, gentlemen.